Cut to the explainer. Today we're diving into a medical mystery, one that's super rare but can have huge, even life-threatening consequences. And it all starts in a place you'd think is the safest, the operating room.
So let's set the scene. It's a scenario that, honestly, taps into one of our deepest fears, right? You go in for a routine procedure, and something goes wrong. Really wrong.
I mean, can you imagine? The doctors come out, they say everything went great, but then hours go by and your loved one just doesn't wake up. They're paralyzed, can't move, can't even breathe by themselves. And this isn't some made-up movie plot. This is real. It's from actual medical case reports, and it's all because of a hidden weakness that gets exposed by the stress of surgery.
Okay, so let's look at a real-life example. We have a 66-year-old guy who goes in for a lung biopsy, something pretty standard. The operation itself, totally fine. But then, when it's time for the anesthesia to wear off, crickets. Nothing. He's just lying there, completely paralyzed. The hours are ticking by, and you can imagine the scene. The whole medical team is just baffled. He can't breathe, he can't move a muscle, and nobody has a clue why. This is the moment when some hidden underlying condition gets dragged into the light.
So what is this invisible culprit? In cases like this, it turns out to be a really rare autoimmune disorder. So let's pull back the curtain and talk about something called Lambert-EATON myasthenic syndrome. We'll just call it LEMS for short.
So what exactly is LEMS? Well, you can think of it as a case of friendly fire from your own body. Your immune system, the thing that's supposed to fight off germs, gets confused. It starts attacking the critical connection points between your nerves and your muscles. And when that connection is under attack, the signal telling your muscles to contract, it just can't get through.
Here's a great way to picture it. Think of a faulty light switch, right? For a muscle to move, a nerve has to send an electrical go signal. But in LEMS, your own antibodies act like, gunk that clogs up the wiring before the switch. It blocks these little channels that are supposed to power up the nerve ending. So the nerve just can't get enough juice to flip that switch on. The go signal never gets sent.
Now, you might be thinking, hey, that sounds kind of like myasthenia gravis, or MG. And you're right, they get confused all the time. But the difference, while it seems small, is actually huge. With LEMS, the problem is before the signal is sent, the nerve itself can't release the message. Think of it as a problem with the sender. But with MG, the nerve sends the signal out just fine. The problem is that the muscle can't hear it. That's a problem with the receiver. So sender versus receiver, that's the key.
Okay, so if LEMS is this sneaky thing that can hide for years until a crisis hits, how on earth do doctors even begin to figure it out? Well, it's a lot like detective work, really. They have to piece together a very specific set of clues.
And it often comes down to this classic trio of symptoms. First, you've got weakness, but it's specifically in the muscles closer to your torso. Think your hips and your shoulders. Second, you see issues with automatic body functions, with a super common one being a persistently dry mouth. And third, something called areflexia. That's a fancy word for when your reflexes, like the classic knee jerk, are really weak or just gone.
But the real smoking gun, the clue that clinches it, comes from an electrical test called an EMG. Doctors are hunting for this one very specific pattern, something called the waxing phenomenon. And it's this totally strange, paradoxical finding that tells them almost everything they need to know.
So here's the weird part that the EMG test shows. When the patient is at rest, the muscle response is super weak. But then you have them contract that muscle for just 10 seconds, and bam! The response doesn't just get a little better, it gets dramatically stronger. It's like that short burst of effort manages to push just enough power through the gunked-up wiring to get a strong signal out. It's an incredible clue because it proves the muscle itself is fine. The problem is all about the signal it's getting, or not getting, from the nerve.
And finally, you've got the ultimate confirmation, the smoking gun. There's a blood test that can actually find the exact antibodies that are attacking those nerve endings. If that test comes back positive, it's case closed. And it's pretty reliable too. It catches about 86% of LEMS cases that are purely autoimmune.
But this is where the story takes a really sharp and much more serious turn. Because for a lot of patients, LEMS isn't just some random autoimmune problem. It's actually a warning flare, a sign of something far more dangerous, hiding in the body.
Get this, in more than half of all cases, LEMS is what's called a paraneoplastic syndrome. That means it's triggered by the body's reaction to a cancer, most often a specific type called small cell lung cancer. It's another case of friendly fire. The cancer cells have little bits on their surface that look almost identical to parts of our nerve endings. So the immune system mounts this big attack on the cancer, which is great, but in the confusion, it starts attacking the healthy nerves too.
And this, right here, is probably the most important thing to understand about LEMS. That muscle weakness, the dry mouth, all those weird test results, they often show up long before any other typical cancer symptoms. Think about what that means. A diagnosis of LEMS can be an early warning system. It can lead doctors to find a hidden tumor when it's still small, and more importantly, when it's still treatable. It can literally save a life.
Okay, so we've unmasked the villain and uncovered its secret connection to cancer. The big question now is, what do we do about it? How do we fight back? Well, the good news is, there's a pretty clear playbook for treating LEMS.
It's basically a multi-pronged attack. First, you go after the symptoms directly. There are drugs, like one called 3,4-DAP, that help boost that weak signal from the nerve to the muscle, giving people their strength back. Second, you have to calm down that haywire immune system with treatments that stop the friendly fire. And third, and this is the big one, if there's a cancer, you have to treat the cancer. That's the root cause. And very often, when you treat the tumor, the LEMS symptoms get way, way better.
And we know these treatments work. That drug I just mentioned, 3,4-DAP, it's a real game changer for symptoms. A major study found that a whopping 78% of patients showed real clinical improvement after taking it. That's a huge deal.
So, let's bring this all the way back to where we started, that scary situation in the operating room. Because understanding LEMS isn't just some interesting medical trivia, it's about knowing the risks and realizing that when it comes to this disease, awareness is absolutely your best weapon.
And the stakes are as high as they get. I mean, look at this quote from a major study. It says it right there in black and white. The risk of your breathing just stopping, of respiratory failure, is way higher for LEMS patients who don't know they have it. The very drugs used in anesthesia, the ones that are supposed to be safe, can push them right over the edge into a crisis.
This is why there are life-saving safety rules for any LEMS patient going into surgery. Rule number 1, certain muscle relaxants are completely off-limits. A drug like succinylcholine is an absolute no-go. It could cause paralysis that lasts for hours or days. Any other relaxants have to be used in tiny, tiny doses and monitored like a hawk. That's why having continuous nerve monitoring during the operation is a must, not a maybe. And if it's possible, using regional anesthesia like a nerve block is always going to be the safer bet.
Ultimately, the story of LEMS is it's such a powerful reminder, isn't it? It shows how these rare diseases hold these incredible lessons about our own bodies, about diagnosis, about these hidden connections we never knew existed. It's a perfect example of how solving one mystery just opens the door to another. It really makes you wonder, what other secrets is our immune system hiding, just waiting to be uncovered? Thanks for joining me on The Explainer.